Morning, Andrea. How are you?
I'm wonderful. How are you?
Yes, I'm great. I'm realizing, of course, that it's the evening at your place.
Yes, we do have a little bit of a time difference.
So it doesn't seem to get in our way most of the time. Andrea, you're in San Diego. Would you tell our audience who are listening to learn some more about the Heart of Medicine event that's happening in 2026 in Central Australia? Would you tell them a little bit about your work?
I would describe my career as a portfolio. So I spend some time as a simulation director, some clinical time as an emergency medicine physician, and I'm also an entrepreneur, author, podcast host, and coach.
Mhm. And on a number of committees and other groups as well.
Many hats, and they all work together to form a really fulfilling career.
Yeah, awesome. You came to Australia last year. It was so great to be together in person. And you and I have had lots of conversations about the different systems and what happens for doctors working in the different systems. The American system is in many ways quite different to the Australian system and different again to, of course, other medical systems in the world. What do you think is really important for us to be noticing about doctor health and doctor wellbeing, whatever system they're working in, whichever health system they're working in?
Yeah. Well, my burnout reached a peak in 2021, which interestingly coincided with getting to know virtually more people in Australia and New Zealand. And the more conversations I had with you and folks like Dr. Cheryl Martin, I began to realize that the grass maybe wasn't fully greener if I just picked up and moved to another country. And thanks to the work that we've done together and being a graduate of Recalibrate, I learned that I had more agency and that when I did the inner work, I needed to work on myself. And it really wasn't going to make my burnout better if I just picked up and moved to Australia or England or across the country here in the United States. There's system challenges everywhere.
Hmm. Yeah, and so I think we've learned together, really with this global community, haven't we? That's developed about the pandemic gave us the opportunity to connect across countries and to find out that there's lots of people working in this space of doctor wellbeing, doctor health, this kind of convergence of us all realizing very similar things were happening, and that in fact human wellbeing is human wellbeing wherever we are. You went on, Andrea, to write your beautiful book, which you have there behind you, and of course I have here too, Revitalized, a guidebook for following your for a guidebook to following your healing heartline, really for doctors, but I think lots of other people have been reading your book too. And it's part memoir. You shared a lot of your own experience and your medical experiences in Revitalized. I wonder if you would share a little bit about what might have happened as you were writing the book and since you wrote the book, in terms of, I guess, the disclosure, the sharing of your experiences. That's not something that doctors always do. And in fact, I think doctors have been taught and trained for a long time to not do that. We're seeing a bit of a shift now, many more doctors sharing their experience. What's happened for you as a result of that?
Well, I love the quote that you say that when someone writes a book, it's to be in communication with the readers, and that's what's happened. You know, opening up and being vulnerable with other people, other healthcare professionals, and you're right, just people that read the book and are interested in the experiences of doctors. It's formed a deeper connection and really helped me heal and know that the trials and tribulations that I've been through, while maybe a slightly different configuration than someone else, there is this shared humanity, regardless of where we practice. Healthcare is hard. And this duality of that we can be the healer and then we can be the patient, and none of us can escape that.
Yeah, yeah, that's right. So we're going to have the benefit of you coming to Australia again in 2026. I'm so excited that we're going to be together out next to Uluru in Central Australia, talking about the heart of medicine with some of our amazing colleagues, Ashok from Canada and Jonathan from the other side of America, and Michelle and lots of amazing people, Kath Kroc from Australia. What is it that you'd like your American or Northern Hemisphere colleagues to be thinking about or to know about the heart of medicine that might help them decide whether they join us?
Well, I think all of us are seeking more from our careers. We spent so much time to develop this amazing skill set. And because of the system challenges, regardless of where you work, that can cause us to sometimes question our choice in careers and what our next career step is. So you may not find a clear answer, but what you will find is connection. And that continued connection is really what opens that door to a deeper understanding of yourself and the possibilities that are out there. And I think while virtual programs are fantastic, um, there is no replacing the magic of going to a place and carving out that time where you can really have deep conversations and spontaneous conversations. And I've not been to Uluru, been to Australia, but I've heard that Uluru is a very special place, an evocative place, and having the views and the scenery along with all the people that you're bringing together, I think it's just going to be a really special once in a lifetime experience. So I hope people will join us, and there's time to plan and protect your schedules. I know all of us are so busy, but 2026 it's coming up, but there's still time to protect your schedules.
Yeah, and I think that was some great wisdom from you and some of your colleagues, that we needed to give people plenty of time to get organised to join us in Australia. And I know it's going to be a very heartfelt, whole person kind of event. We're having, just amazing messages from people about wanting to come and be a part of what really is a movement inside of other movements. I think that the gathering of kindness and lots of other ways that people are saying, let's prioritise what it means to be connected, to be human. And, let's actually, I love that word you use, let's actually evoke something different, something that really might be nourishing and fulfilling for us together. So thank you for your time today. I look forward to talking with you lots more as we kick off some of the other work that we're doing together, and I'll see you soon.
Sounds good. Can't wait.